In this video, you will learn about the normal shape of the spine, how the spine gets bent out of shape, and a few foam roller stretches that can help. From the back or front viewpoint, the spine is normally a straight column, with the head vertically aligned over the pelvis. From the side view, the spine is normally arched forward in the neck, backward in the mid-back, and forward again in the lower back, with the vertical alignment of the head and pelvis remaining intact. The back of the head, shoulders, and hips should also be in relative vertical alignment. Mostly as a result of poor posture habits in sitting, in standing, and in lying down, the mid-back or thoracic spine becomes overly rounded, relatively displacing the rib cage backward and the head and neck forward. This produces a structural rigidity of the thoracic spine, independent of an upright or lying position. The structural deformity of the thoracic spine, called hyperkyphosis, that results from poor posture includes significant health consequences not well appreciated by most people. The head-forward position chronically strains neck and jaw muscles, compresses cervical spine discs, and aggravates headache symptoms. The rounded back position often leads to accelerated disc and bone degenerative changes and stiffness in the thoracic spine. The stomach and intestines in the abdomen are compressed, decreasing their blood supply and digestive efficiency. The diaphragm and lungs in the chest cavity are also compressed, decreasing oxygenation and breathing efficiency. The shoulders are pulled forward, tightening the chest and altering normal scapular and shoulder motion, often leading to rotator cuff injury from repetitive strain or sport activities. And the lumbar discs are highly compressed, promoting disc bulging and back pain. It should not be surprising that rigidity or deformity of the normal shape of the thoracic spine causes wide-ranging problems when you consider that the head and neck, shoulders and arms, and lower back all connect to the thoracic spine. In evaluating alignment, even without an X-ray, one can often see obvious changes in alignment of the spine in the forward bent position, both from the back view and from the side view. From the side view, there should be relative uniformity in the rounding of the spine during forward bending. As you can see in these examples, the thoracic spine is non-uniform, with peak roundedness occurring in the mid-back area, indicating abnormal rigidity and hyperkyphosis. The foam roller is one important tool that can be used to decrease mid-back rigidity and begin to correct the structural deformity of thoracic hyperkyphosis. Let's go over some rules of the roller. Relax as much as possible at all times. Move slowly over each spinal segment. Go only as far as your body allows. Give a full minute or so to each stretch before moving on. The 4 foam roller stretches we will review are the rounded stretch, the flat stretch, the extension stretch, and the hip flexor stretch. The rounded stretch is performed by rolling from the upper rib cage and slightly curling up as you roll down to the lower rib cage. The hands support the back of the head at all times. The flat stretch is performed by rolling from the upper rib cage to the lower rib cage with the back remaining level at all times. The extension stretch is performed by rolling from the upper rib cage to the lower rib cage with the arms out, palms up, and the head back. If you can't perform this stretch because your back is too rigid, then practice the other stretches daily for several weeks before trying this one again. The hip flexor stretch is performed by supporting your pelvis on the roller and extending your shoulder and hip on one side while you flex the opposite side hip and knee. Ultimately, you will also need to correct poor posture habits. A few minutes on the roller each day alone cannot overcome hours and hours of rounding your back. You must practice better posture and use the roller for best results. For more information on posture and ergonomics, please visit Amazon.com and the Science of Sitting Made Simple book.